Hello, it's another edition of NCDC Situation Room on the network service of Radio Nigeria. I'm glad you joined us again today. I hope you found our maiden edition rewarding. Well, here is another edition for you. Good evening and welcome. How has your day been? Splendid, I guess. Good. So, let's get to the business of the day, shall we? Today we start with some updates on the nation's preparedness to combat infectious diseases. Now, about 2 weeks ago, President Muhammadu Buhari signed into law the Bill for an Act to establish the Nigeria Center for Disease Control as a demonstration of his commitment to national health security. Since its establishment in 2011, NCDC has demonstrated its capacity to protect the health of the people by delivering on its core functions of preparedness, detection, and response to outbreaks of infectious diseases. This new act, which establishes NCDC as a full-fledged parastatal, gives sustainability and creates support structure for the work of the center. The chief executive of the agency, Dr. Chikwe Ihekwazu, said the act will provide Nigerians with an institution that has the capacity to ensure the country's health security. Dr. Ihekwazu expressed appreciation to the President, Muhammadu Buhari, the Minister of Health, Professor Isaac Adewale, and the Senate House Committee on Primary Health Care and Communicable Diseases, led by Senator Mao Ohabunwa, for their support. Well, let's take a pause here to allow for some commercials. When I return, I'll tell you something about one of the diseases of focus for NCDC, Lassa fever. Stay right here with us.
Wetin be this Lassa fever wey dey hear up and down so?
This na disease wey Lassa fever virus dey cause. E dey happen when person touch another person or rat wey carry this virus poo-poo, wee-wee, spit or even blood, and e no dey send age o.
Abeg, how fit take know person wey carry Lassa fever sef?
The sign dey show 2 to 21 days after person touch another person or rat wey carry this virus. Dem fit dey catch cold or weak or get body pain or sore throat or dey vomit plus purge or cough or make their body no dey fit stay one place or make faces swell up or make blood dey comot from any part of the body. Person wey get Lassa fever fit be like say na any other disease.
How we fit take stop this Lassa fever?
No near rat, dead or alive. Keep your house plus area clean. Store water plus food where rat no go reach am. No spread food for road or even open place. Dey careful with person wey get Lassa fever or the one wey Lassa fever kill. Make sure say you follow wetin government talk before you bury am o.
Dem fit treat this Lassa fever?
E better make you treat am early immediately you notice am. So no waste time o. Go the hospital wey dey near you immediately you begin get the sign.
This message na with Federal Ministry of Health, the Nigerian Center for Disease Control, World Bank Ready Say Project, and UNICEF.
Thank you so much for staying with us. The program is NCDC Situation Room, and today we're talking about Nigeria's preparedness and response to disease outbreaks with special focus on Lassa fever. Now, if you haven't heard or know very little about Lassa fever, here are a few tips about it. Lassa fever is caused by rodents or rats, as we popularly call them. There are a number of ways through which the virus may be transmitted to humans. The rodents shed the virus in urine and droppings, and the virus can be transmitted through direct contact with these materials, either by touching or eating food contaminated with the rodent's urine or excretion. Now, because these rodents or rats often live in and around homes and scavenge on human food remnants or poorly stored food, transmission of this sort is very common. Contact with the virus also may occur when a person inhales tiny particles in the air contaminated with rodents' excretions. The scary thing about the mode of transmission is that the rodents are consumed as food by some people. This can cause infection if not well cooked and may be dangerous to the health of those who prepare the rat or eat it as delicacy. Well, at this point, I'll take the back seat and allow a few minutes for our drama group to give a message or two. Over to you guys.
Egbami, how can a kuti oju binti bayilo small rat activities send a whole man to his grave? Ọlọ́run ọba. Okay, come to think of it, that Dr. Chukwu said these rodents like bushy and dirty environment. We are in trouble o. Usman's wife keeps her dustbin close to the kitchen, and there are lots of rats in their house. And I ate her food yesterday. Hey, Mogbe.
Sanu, Chibadisa, what is the matter with you? I say from down there near that junction, I can hear your voice clearly, just talking to yourself, by yourself, even confusing yourself, I'm very sure. But this is quite unlike you, Mebaru.
Malam Usman, Kabojari, welcome. I was just thinking aloud.
Yes, of course. That was why I can hear you from that junction. But what is the matter with you?
Well, nothing is the matter.
Chibadisa, you know that I know you too well, and there's hardly anything you can hide from me for. Well, my wife Belikisu just called me to inform me that dinner is ready. And let's go and eat now together as usual.
Not today. Talofeku. See, Usman, no? I am not going with you.
Adisa.
Ilé wọn náà nù ni. Ilé wọn náà nù ni. Ilé abẹ̀rẹ̀wọ̀. Bí ilé èkúté. See, Usman.
No?
There are too many rats in your house. I don't want to eat there again. I don't want to die. The possibility of rats sneaking into your kitchen and contaminating your food is very possible. Joe, Tori Olorun, I beg you in the name of God, go and eat your food alone and die alone.
Adisa, is this coming from you?
Since Dokita said rats are the carriers of that Lassa fever, I have decided not to visit any home where rats are the landlord. And it is rats that causes Lassa fever, which is very deadly.
Did you see any rats in my house? No, Adisa, tell me, have you ever seen any?
There are rats in your house. Let me tell you, the other day, I saw a rat psychedelically walking about on your dining table as we were sitting on the other side, practically waiting for invitation to come and join us and eat with us. I saw it all. And then, as I entered your wife's kitchen to drop plates, I also saw another one majestically dancing on your pot as if it owns the house with you. Joe, so for me, are you sharing rent with rats? Oh, me ò fẹ́ kú o.
Adisa,
I don't want to die.
Wait. My phone is ringing. I'm coming. It's my wife, Belikisu. Hello? Belikisu? Na menene? Oh, I've been chatting you now. Did you say food is ready? Oh, my favorite. Okay. Oh, my beloved. That is why I like you. I'm coming right now. I'm coming right now. Adisa, I will see you another time. Let me go and eat my food alone.
Wait. Did she say it is your favorite one that she prepared?
It is none of your business.
Wait now. Come, is it amala with draw soup and catfish head? Why I like that one.
Why are you asking me? Look, there's a rat in my house.
Tell me now.
There's a rat in my house.
Man, tell me.
Good evening, sirs.
Doctor.
Dr. Chuku.
Malam Usman.
I was about to leave you, man.
You're already?
Yes.
I have come to see both of you on the latest development in our community.
Dokita Kabojari, welcome. What news do you have for us now?
Thank you, sir.
Yes, sir. Look, I thought you told us they are prepared to handle any outbreaks. What is it again?
Oh, yes, I am. But as I told you yesterday, NCDC sent me here just as we have other representatives of the center across the country as part of our preparedness for any outbreak of any of the seasonal communicable diseases such as Lassa fever and cerebrospinal meningitis.
Okay, wait there. Which one is meningitis, conjunctivitis, whatever?
Just hold on.
No, you like confusing.
Oh, hold on. I will come to that. But first, I must tell you how to prevent yourself from the deadly Lassa fever. As I told you, it has no respect for anybody. Imagine, a person can contract it from handling a victim. Doctors, nurses, and even relations of a person suffering it have contracted it and had consequently died from it.
Doctor, wait. Only even doctors and nurses like yourself are not spared.
That is why we are saying prevention is better than cure.
But come, Dr. Chuku.
Yes.
You see, I am very, very happy and delighted you are in our community to help prevent us from this Lassa fever and other terrible diseases. So, where are you going to start this your prevention from? Is it from our houses?
Yes. Usman.
Thank you.
Very good question.
Thank you.
Doctor, tell us, And I will actually suggest you start the job from my house so that me and my family will be saved from this deadly rat. From my house, you understand?
I don't like this kind of stuff. How can somebody bring idea? Am I not the one that person started to talk about this? It must be my house.
Usman, don't joke with me. Doctor, you must start from my house.
You see, the issue is not where it will start, but the commitment and seriousness as well as consistency we attach to the efforts to keep our homes and environment clean and free from those things that can attract rodents to our homes.
How?
We have to make sure rats are prevented from where we have our foods.
All right, thank you, doctor.
Beautiful message indeed. We do hope you picked a lesson from that piece. Well, don't leave us to do the talking alone. You too can be part of the discussion. So talk with us through Twitter. The handle is @NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us through a toll-free line, meaning you don't pay when you get a call. 0800 9700 0010. I'll take that again. 0800 9700 0010. Send message only to 0809 955 5577. We're also on WhatsApp and the number is 0708 711 0839. Thank you. Now, as usual, we visited some neighborhood to hear their opinion on Lassa fever and disease outbreaks generally. Here's what we got.
I think Lassa is a village in Borno State. Since when we were kids, we heard about it. Like my house, if you go, I have a cat because they said that the Lassa fever is transmitted through a rat. So wherever there is a cat, you will not see a rat. That is why I got a cat inside my house, so that I will make sure that I don't have a rat inside my house.
Whenever somebody is sick, I don't lay my hand on him directly. I make sure I put a glove, or I will go to a closest clinic to tell the doctors to come and take him. Or eventually, if I touch the person, I do use sanitizer to wash my hand immediately before anything.
Like my place, sometimes like during February, March, April, the temperature sometimes used to be 43, 42, 41, 44. I'm from Adama, so we are always proactive. Most of our houses, we see like 2, 3 standard windows, 3 or 4. During that times, we don't close our windows, we don't close our doors to protect ourselves from meningitis.
If you are still under 30 years or thereabouts, you can still go for immunization. But if you are past 30 years, even though you have even taken the immunization, just make sure you are in a very ventilated environment. Make sure you spend most of your time outside the house so that breeze can flow. You can enjoy the breeze and less heat. And at night, make sure you open all the windows and you have window net. But if your window did not have burglary proof, don't open it too.
All right, some people there expressing their opinions on some of the diseases of concern to NCDC. Now, let's go to the Situation Room, where Godwin Odemije is waiting. Godwin.
Yes, Abdul.
What's the update from the Situation Room?
Well, experts are saying that the dry season is here, and it is a period we have to raise the level of alertness, especially for Lassa fever. Let's go to the experts in the field to tell us what they have on the ground, at least for prevention. I am being joined on the line by Dr. Lawa Bakari. Hello, Dr. Bakari. What is in place for Lassa fever prevention as we move into the dry season proper?
Okay, thank you very much. If you look at the way the disease is being transmitted, just looking at the animal to human transmission, we realize the need to bring forward the One Health approach to prevention this year. Like we've been doing before, but this time better. We are bringing the Ministry of Health and the Ministry of Agric to work with the human health sector to see how better we can actually address some of the issues. One area is the infection prevention and control in health facilities to make sure that the human-to-human transmission that we see, especially in health workers or in hospital environment, is minimized. Then secondly, we are looking at the agric sector to work closely with agric and then the environment factor and the environment sector to bring together the One Health approach to prevention, which will allow us to look deeper into how rodents even stay where they live in the wild, and how we can control them to either stay far away in the wild without penetrating the human population.
Okay, but I do know NCDC is not alone in this game. How much support do you get from other agencies working around prevention?
Okay. As part of efforts to improve prevention this year, we are working with the Ministry of Environment at national and hopefully at the state and even at local level to make sure that everything environmental sanitation and environmental factors and regulations are better instituted. So we are hoping that even the environmental health officers will be much more participatory this time, and the Ministry of Environment at the state level are also much more participatory in our efforts to ensure much more robust prevention.
Okay, thank you very much, Dr. Lawa Bakari, for speaking with us on the program.
Thank you very much.
Dr. Lawa Bakari is a member of the risk communication pillars of the NCDC Situation Room. Back to you, Abdul.
All right, thank you very much, Godwin Odemije. It's now time to meet my guest on today's edition of NCDC Situation Room. And I'm happy to let you know that my guest from last week made a return to talk with us more on the level of preparedness to disease outbreaks. Dr. Chikwe Ihekwazu, Chief Executive Officer and National Coordinator of the Nigeria Center for Disease Control. Dr. Ihekwazu, thank you very much for joining us again on Situation Room.
Thank you very much.
Now, Doctor, let's talk about Lassa fever, one of the many diseases you're contending with at the center. For many years, we've battled with this particular disease with so many deaths on its trail. I'm aware NCDC has done so much in this regard, but we're approaching that time of the year where indices of Lassa fever are on the increase. How well will you say Nigeria is doing in terms of tackling Lassa fever?
Lassa fever is a very interesting and very complex disease. The reason for this is that it presents in a spectrum of ways. 80% of cases of Lassa do not have any features at all. You can get infected and not get ill. Another 10% get ill, but just have features of what could be similar to any normal case of malaria. Another 10% would get very ill, potentially with features of bleeding and potentially die. So what has happened in the past is that we have only really been in a position to detect the last 10%, the very severe cases. But as we have improved our surveillance, we've improved our awareness, improved our lab capacity, we're now finding all those cases that we were not previously finding in the past. So what has happened is, as we've found these new cases, the demands of the response has increased. And it's a good thing, because the more cases you find, the less opportunities they have to transmit to each other. So in a way, we're victims of our own success. As we have looked more, we're finding more, and we're responding. But the more we find, the more we're in a position to prevent transmission from one to the other. So in summary, Lassa is endemic in many parts of Nigeria. Because of that endemicity, we have improved our ability to detect. As we find more, we treat more, and once we get over that peak, we'll be in a much better position to respond to this disease.
All right, Dr. Ihekwazu, I'm very concerned about the death toll from the last outbreak. The number was just too many. Even medical practitioners were not spared, and it was as if the incidence was not going to abate. So my question is, how do we reduce the number of mortality when there is an outbreak of Lassa going forward?
I think the key message for Lassa is really to increase the index of suspicion. Now, the earlier you find a case of Lassa, the better your chances are of managing that case successfully and preventing death. So what you'll find is that, yes, altogether, the case fatality ratio was fairly high, close to 20% across the country. But if you look at centers like Irua Specialist Teaching Hospital, you find that the case fatality ratio is closer to 10. The reason is, in certain centers where they've become very good in detecting and treating early, they're finding the cases early, managing them, and we're saving lives every day. In states where Lassa is not as common, doctors will manage for malaria, you fail, do something else. By the time they think about Lassa, that patient is already at the point of passing away. And by that time, your chances of success are very low. So our big message this year really is that we know what to do. We know the tests to use. We have access to those tests. Please think about Lassa early. Send us a sample. We'll send you the results, and you can make that diagnosis, treat the patient early, and save that patient's life. So one of our biggest strategic goals as we move into the next season is to reduce the number of cases dying from Lassa fever. The approach to that is early detection. And early detection means every doctor should know this is Lassa fever season, take a sample early, let's test for Lassa. If it's Lassa, let's treat. If it's not Lassa, let's look for other causes of fever.
But doctor, could it not have been much easier for easy detection if we could have more centers like that of Irwa? I'm asking because you said early detection is the key.
The biggest issue here really is the laboratory. Now, the test for Lassa is a fairly complex test. It's not like your malaria that you can just do a pinprick and test. So it requires a very sophisticated laboratory system. And it's not easy to develop, including the expertise. So what we have done between last year and this year, we've increased the number of labs with that capacity to 4 in Lagos, Irua, Abakaliki, and here in Abuja. And we have divided the states so that every state knows where to send the sample to, in addition to a sample transportation mechanism. So I agree with you completely that as we improve our ability to detect early, we'll be better able to treat early. But the other thing is, with Irua, we went around the country training doctors generally to detect and respond. We have 3 excellent centers at the moment. Irua was the first and the most established. 2 new centers have really come on board over the last year. Federal Medical Center, Owo, and Federal Teaching Hospital, Abakaliki. With these 3 centers, we have a good base of clinicians that have really become experts in managing Lassa fever.
Okay, now tell us, do we have any current cases at hand?
Yes, we always have a trickle of cases throughout the year. You will see on our website, we've been very proactive in sharing these cases. Every week, we provide an update on the number of cases. We have a very good system now. There's almost no other disease for which the surveillance is as good as Lassa. Once the cases are detected, we have a mechanism to report, a mechanism to support the states in the response. They can get help both in clinical management, risk communication, all aspects of the response is very well coordinated. And we're really preparing for next year to ensure that we do even better in managing cases as they arise.
Now, from what we read, the first case of Lassa was about 50 years ago. How much do you still cope with the predisposing factors that caused the very first case compared with what we have now?
Yeah, so you see with Lassa, there are 2 primary ways of transmission. One is what we call spillover events from rodents, where rats have access to foodstuff that humans ultimately will eat or drink. So the first key message is preventing access to food at homes to be infected by rat excreta. The second mode of transmission is when there's actually an infected individual who then transmits to another. And the people most at risk are family members caring for ill patients or healthcare workers caring for ill patients. So the healthcare worker transmission is actually easier to prevent. The biggest challenge we have are rodent transmissions because transmission from rats to humans, there are many factors leading to that. It's socioeconomic conditions of where people live, overcrowding, sewage, the things that attract rats into homes and all of that. So it's very complex to completely eradicate and not entirely in the hands of the health sector. So we continue sending these messages. Going back to the point you made, next year, is 50 years of the detection of Lassa fever. Last year, we were very aggressive in increasing our understanding of the dynamics of Lassa fever. We're doing a lot of research, both in animals and in humans, and we're publishing in very popular journals around the world in the scientific community. I think what I'd like to say here is next year in January, we're hosting a big Lassa fever conference, bringing the entire scientific community together to look at what we know about Lassa, what the gaps are, and to define the research priorities for Lassa moving forward.
Now, as we close this discussion, Dr. Ihikwazu, what do you think is actually the safest way of diagnosing these infectious diseases, considering the fact that that's where the problem lies majorly Because when we cannot diagnose early enough and adequately, we give room to guesses and hunches that could lead to so much fatalities.
I think the most important thing is to remember that every fever is not malaria. I think this is so important, especially now that we have a safe and effective test for malaria. So we need to think about malaria, do that rapid test. If it's malaria, we go ahead and treat. If it's not, we look for other issues. If we keep treating without testing, which many of us have gotten used to, then we will not get out of this quagmire. So the most important thing is to realize that not every fever is malaria. Test for malaria. If it's not, then immediately you start looking for other things. The other key message is one of universal precautions. Use your gloves, use your mask as appropriate. Yes, it will cost you 50 naira or whatever, but that is what will save your life. So if you don't have it, push your hospital to invest. If the hospital doesn't, find a way of finding solutions. Don't take it for granted, because taking that one step for granted can lead to a loss of life. It's like wearing your seatbelt is difficult. Wearing a condom through sexual intercourse is difficult. These are decisions you have to make. It's the same way we have to think about wearing gloves, using universal precautions. Not once in a while, not when you have it, but all the time.
Indeed, a message there for medical personnel. Wear your protective kits all the time. You at home, keep your home free of factors that can cause diseases by observing your normal hygiene. Keep rodents away from your home and avoid exposing your foods and drinks. We must say a very big thank you to you, Dr. Chikwe Ihekwazu, the CEO and National Coordinator of the Nigeria Center for Disease Control. Thank you very much, sir, for coming.
Thank you very much for the opportunity.
And that's the size of the program NCDC Situation Room for today. I believe you learned something from it. If you did, please join us again next Monday, 5:30 p.m. is the time. Before then, reach us via Twitter. The handle is at NCDCGov. On Facebook, we're Nigeria CDC. You can also reach us through a toll-free line. That's to say that you do not pay when you call 0800-9700-0010. Send a message to 0809-955-5577. Please do not call and do not flash. Simply send a message. We're also on WhatsApp. The number is 0708-711-0839. Thank you very much. This program is a production of Gado Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. Visit their website to know more about the center. It's www.ncdc.gov.ng. Executive producer is Godwin Udemije. He also wrote the drama script. Mobolaji Ajani is the producer of the program. I'm Abdul Fattah Otori. Until I come your way again next Monday, I implore you to stay safe and stay away from rodents altogether. See you next week.